That's a very complicated question, only because what we have is a large number of individuals who are in the retirement phase of their lives are now finding out that their children have an addiction to a substance and they can't handle the responsibility of child rearing. Consequently, grandma and grandpa take on the role of not only parenting their child, but also parenting their grandchildren. If mom and dad have an addiction to an opiate and they're not able to function to parent adequately a 2, 3, 4, or 5-year-old child, then grandma and grandpa take on the role of both taking care of their child as well as their grandchildren. The most effective thing that you can do is get professional help as quick as you can so that you can learn some coping strategies, so that we can develop some behavioral changes so that the parent can get healthy. At the same time, mom and dad, or grandma and grandpa in this case, need to be in a position where they can make decisions for the grandchild. Oftentimes these will be in conflict with what mom or dad think they should be doing. However, the responsible party is in a position where they can't make responsible decisions as a result of their substance abuse. So consequently, all three generations need to work collaboratively to bring about the most effective way to rear a young child in an environment that is going to be fraught with difficulties as a result of substance abuse that occurred prior to the time, oftentimes, that the child was even born. So grandma and grandpa need to get a lot of support and get some professional intervention to show them how best to navigate these difficult times for them. If an individual with an addiction comes here requesting treatment, we try to involve as many people as we can. Oftentimes that's grandma and grandpa or mom and dad. Everyone has to be involved because the process of an addiction is an extremely deceitful process, that the drug lies to the person who has it. So we need a lot of monitoring, we need a lot of accountability, we need a lot of behavioral changes, and collaboratively we'll work with the grandparents or whoever the person is that's supervising the person with the addiction to make sure that all three of us are on the same page, because it's extremely common that the person who has the addiction to fragment the intervention strategy, so they will tell grandma and grandpa one thing and will tell us something quite different. Once we have eliminated that ability to distract or separate the intervention strategies, the patient usually seems to respond a lot better to a consistent intervention position where everyone knows what's expected and we have outcomes that we want the patient to achieve based on our mutual intervention strategy.